Good morning, everybody. My name is Jody Martin at the Illinois Department on Aging. I've been here over 20 years, most of it working with our community care program and training throughout the state. So today we are very lucky to have two very lovely ladies from, I'm going to have them introduce themselves, but they're from Age Options in the northern part of the state, and they're going to help us understand some referrals, some tips, some things that we can use to help prevent falls that we can use, and we can also share with our participants. So this should be interesting. We will, before anybody asks, have a PDF copy of the handouts. It will go out when the recorded webinar goes out. So it'll be in the same email, and then we'll have the PDF of the presentation. So we have that. Also, if you are signing up for CEs, that will be through the survey at the end. So be sure to have your number with you. You have to have your number and what kind of CE you need for you to receive the final copy, okay? After the email, there will be after the presentation, you will receive an email. It might say, this is to fill out the survey. There is only one survey, so if you've already done it, that's it, you're done. You do not have to do it again. But it has the questions on there for you to fill in to get those CEs. So be sure you follow through to that. But please, we would, even if you don't like CEs, go through, follow the survey, answer it for us. It really helps us know what changes we can make, what we get out of it, what you knew before the presentation, and how much you learned in this one. So, okay, it looks like we have 140 people on there. Again, we had 245 for registration, but I know a lot of you like to share those big screens, sit and watch it together, perfectly acceptable. So our numbers won't get as high as the registration, but welcome to everybody as you come in. We are going to have some videos within the presentation. In the past, we've had a lot of problems with those, but I think we have worked it out. So all the testing, everybody's able to hear right now. So text me in the box if you're having difficulties. There's only one or two people having difficulties. It might be from how your computer's set up. Okay, so let's go ahead and get started. I'm going to hand it over to Peggy and Katie, and they can tell us about themselves before we get started. And we will say, good morning, ladies.
Hi, greetings, everyone. I am Catherine Thom, but my friends call me Katie. I'm the Community Programs Manager at Age Options, and I'm so excited to be with you all today. Thank you so much for taking your time to sit with us. I know times are very busy right now. I'd like to start off by thanking Jody Martin and Mike Burks and the Illinois Department on Aging for this opportunity to speak with you all today. I hope that you all will be as excited about this collaboration as I am, and I hope that you will see value in our programs for your clients. A little bit of background on myself and why I'm here today. I joined the Age Options team in February 2019. In this position, I oversee our elder justice programs to include adult protective services and the long-term care ombudsman program. I also oversee our area's caregiver support programs and faith-based initiatives. And finally, why I'm really here today is I oversee a statewide health promotion network hub called the Illinois Pathways to Health. Prior to joining the Age Options team, I was the Health Promotion Programs Coordinator with the Department on Aging and Independent Services with the County of San Diego, which is their area agency on aging. There, I got trained as a master trainer in the Chronic Disease Self-Management Program and leader trained in the Chronic Pain Self-Management Program. Then, when I got here to Age Options, I got trained as a Diabetes Self-Management Program leader. You'll learn more about these programs later today in this presentation. But I'm telling you about my training so that you can see where my passion and experience is coming from in this presentation. These programs have my total buy-in, not only because I am trained and facilitate these programs, but because I see the value that they bring to the lives of our participants firsthand through the workshops that I facilitated. I also told you about the other program areas that I oversee today because I'm trying really hard in my position now to create linkages between all of the programs under my oversight and hopefully other programs within your organizations, because there's so much opportunity for cross-referring to optimize support and services for the older adult community that we're serving. Now I'll get off my soapbox and I will let my colleague Peg Kelly introduce herself.
Thank you, Katie. Good morning, everyone. As Katie said, my name is Peggy Tully, and I am the Health Education Implementation Coordinator at Age Options. I've worked at Age Options for almost 11 years. I began full-time with Age Options, working with the Senior Medicare Patrol Program, and I have been in this current position since September 2018. I was master trained in the chronic disease self-management programs 7 years ago. I've also been master trained in a matter of balance just a little over a year, and just recently trained in bingo size, our evidence-based programs. I'm very passionate about these evidence-based programs as well, just as Katie had mentioned. I facilitate leader and coach trainings, facilitate our evidence-based workshops. I provide technical assistance to our delivery partners as well as our volunteers who lead and facilitate workshops. And I too would like to say thank you, Jody. Thanks to IDOA for providing this opportunity to talk to you today about our evidence-based programs and how they can benefit your clients. With that, thank you, Katie.
Thanks, Peggy. All right, so a quick overview of what we're going to cover during this presentation. We will start off with some background on who we are and what the Illinois Pathways to Health is. We will discuss evidence-based interventions such as health self-management programs, fall prevention interventions, and we will provide an overview of our programs and ideal candidates so you will know which programs your clients may benefit from most. We will then go through our newly launched website, and so new, I mean a matter of weeks ago it launched. On there, we'll show you how to find upcoming workshops, how to make direct referrals to us, and how to find handouts that you can print out and provide to your clients during face-to-face visits, or you can provide a follow-up electronically through email. We'll have time at the end for questions, but please pop questions in the box as we go along. The final slide of the presentation also contains some links and handouts and references that you can reference after our presentation is concluded when we email this out to you.
Hey, Katie, this is Jody. Got a little bit of fuzziness in your the speech, and it's not your speech. It's something, maybe your microphone's hitting you close or something. It didn't do it in testing, of course.
Okay, I just kind of readjusted things. Does that sound better?
It helps, yes. Okay, all
okay,
yours.
Great, thank you. Thank you. So, the Illinois Pathways to Health Initiative is a statewide network hub to act as a one-stop shop for evidence-based health promotion programs for residents throughout the state of Illinois. We are an initiative of the Suburban Cook County Area Agency on Aging, known as Age Options. We believe a sustainable, integrated, evidence-based health promotion network will improve access to valuable community-based health education. The network will support clinical community linkages, bridging gaps in public health prevention strategies. Illinois Pathways to Health will connect nationally recognized evidence-based interventions and programs known to enhance physical and psychological well-being of participants. Our programs are designed for older adults, so adults 60 years and older, and adults with disabilities 18 through 60, and their caregivers and family members of older adults and adults with disabilities. However, we are not checking IDs at the door. We really, generally speaking, our programs are open to anyone who is interested in learning how to better manage their chronic condition or want to reduce their risk of falls. We will talk more about specific programs later in the presentation, but they are all multi-week series that are designed to have participants build relationships with one another as they learn these new skills. So they also act as a great intervention for social isolation. They are not designed for professionals to pop in when it's convenient, and you'll see that I'm saying that because it's a problem we've had recently. So if you'd like to learn more about one of our programs that we talk about today, please check out our YouTube page. We have some videos there, or contact us and our team can do a demonstration for you. All of that said, we do actually have one program that is designed specifically for professionals, and it's facilitated right in your workday as a lunch and learn, the Workplace Chronic Disease Self-Management Program. Later in this presentation, we will discuss the Chronic Disease Self-Management Program known in Illinois as Take Charge of Your Health. And if this program sounds like it'd be beneficial for you and your colleagues, please reach out and we can set up a workshop series for you at your organization. To be able to have the reach that we do and have this be a statewide initiative, we cannot do it alone. We are fortunate enough to have 39 delivery partners throughout the state. We partner with a myriad of organizations such as area agencies on aging, public health departments, universities, hospital systems, and other nonprofit organizations. When we are back to delivering programs in person, we are happy to serve a large swath of the state. All of the counties listed here in gray are counties where we already have partners delivering evidence-based programs. The yellow counties are areas that we are hoping to expand to in the next couple of years through funding from the Administration on Community Living. The colors and symbols might be quite small here for you depending on the size of your screen, but if you can see them, each symbol represents a different program that we are operating in that area, and there's a little key there on the left. The silver lining to the pandemic is that it forced program administrators to adapt and allow programs to be delivered virtually, which were not allowed to be delivered virtually previously. Now that we are nearly a year into this delivery method for many of our programs, program administrators have agreed to allow virtual facilitation to continue even when it's safe for us to go back to offering in-person programming. And this is great news for some of our rural areas and homebound individuals. This is also a great opportunity for caregivers who have care responsibilities, so they might not be able to leave their house for several hours at a time for multiple weeks. So even if your county is not listed in gray here, or you have clients that could not make it out for in-person workshops, we can still serve your clients through this virtual programming now and for the long term. And if your organization is interested in becoming a delivery partner, please follow up with me after this presentation. We provide training and compensation for most of the workshops that we offer through the Pathways House. So now that I've used the phrase evidence-based intervention a few times, let me tell you what that actually means. Evidence-based programs, known as EBPs, offer proven ways to promote health and prevent disease among older adults. They are based on research. Programs go through several different studies with different populations and in different settings, and they consistently provide the same documented health benefits. So you're confident that they work. Now, Peggy's going to tell you about each of the different programs that we offer through the Illinois Pathways to Health in the state of Illinois.
Okay. Thank you, Katie. And so I just want to talk to you first about some statistics in relation to older adults and chronic conditions. And this image that you are seeing, it was developed by NCOA, National Council on Aging, utilizing data from CMS, Centers for Medicare and Medicaid Services. And as you can see here, about 80% of older adults have one chronic disease and 68% have two or more. And so what does that mean in Illinois? In 2017, there were almost 25,400 deaths due to heart disease and just over 6,000 deaths due to stroke in Illinois. And you know what? That represents almost 29% of all deaths in the state of Illinois in 2017. And if we look at these 10 common chronic conditions, many of those conditions are related to heart disease and stroke. Also, if we take a look at arthritis, according to the CDC, between 21 and 23% of adults in Illinois have arthritis. So that could potentially mean that every 1 in 5 of your clients could have arthritis. Chronic conditions, chronic diseases can affect a person's ability to perform important activities. They can restrict their engagement in life, as well as their enjoyment with family and friends. Many adults with chronic conditions, they often struggle to find ways to manage their condition. They may feel a sense of hopelessness, loss, frustration. What do I need to do? Where do I turn? How can I find information? How do I manage this? They may feel a sense of, and one way in which individuals can learn to deal with their symptoms and their condition is through education. And that is where our evidence-based programs can help your clients. Katie, next slide, please. We're going to take a closer look at diabetes in the United States. The next 3 slides that you will see are all snippets from an infographic from the CDC and prevention. And as you can see here, there are 34.2 million people in the United States have diabetes, which is about 1 in every 10 people. And 1 in 5 people don't even know that they have diabetes. Next slide, please. And if we take a look at pre-diabetes, 88 million American adults have pre-diabetes. and that is more than 1 in 3 adults. And of those 1 in 3, 8 in 10 of those adults with prediabetes, they too don't even know that they have it. Next slide, please. However, by making lifestyle changes, by eating healthy, being more active, that can cut the risk of a person getting type 2 diabetes in half. And evidence-based programs help to make participants aware of those small changes that they can make if they so choose. So now that you have a little background on who we are and some statistics related to chronic conditions, let's talk about the programs that Age Options offers. Next slide, please. Thank you. First, I'm going to talk about our evidence-based health promotion programs. Katie had mentioned earlier, the Take Charge programs are known nationally as the Chronic Disease Self-Management Programs in Illinois, known as Take Charge of Your Health. They were originally developed at Stanford University. The Take Charge programs are proven to help older adults better manage their ongoing health conditions, improve their quality of life, as well as lower healthcare costs. And our programs consist of Take Charge of Your Health, Take Charge of Your Diabetes, the Mando Control de su Salud, which is a culturally adapted Spanish language version of Take Charge of Your Health, the Mando Control de su Diabetes, which is a Spanish language version of Take Charge of Your Diabetes. Katie talked to you earlier about Workplace Take Charge of Your Health, which is an adapted version of Take Charge of Your Health, and it is arranged into 1-hour segments in order for the workshop to fit into the office hours. Take Charge workshops, they're very interactive, and they're designed for individuals with any type of ongoing health conditions, such as those that we previously saw, and including family members and or caregivers. Participants learn about skills and tools to help manage their health as well as their condition. And workshop sessions consist of anywhere between 4 to 7 activities per session. Next slide, please. Thank you. So here is a list of some of the topics that are covered during workshops. And I want to talk about physical activity. You know, so often people don't know where to begin with physical activity. They think, oh my gosh, I have to join a gym. I have to go get new shoes, new clothes. I can't fit the time in my day. But during workshops, we discuss the importance of moving and being active rather than a vigorous workout. We especially emphasize that when beginning physical activity, participants start at the level that they are currently at. So they don't have to go out, they don't have to run a marathon, just get moving. With healthy eating, we don't talk about diets, rather we discuss healthy food choices and reading labels. And that's so that participants can be aware of what they are eating and how the food they are eating may affect high blood pressure or high cholesterol. Here you can also see other topics, medication usage, pain and stress management. We really talk about effective communication with family and friends and, very important, healthcare providers. We do some goal setting, problem solving, action planning, and you'll see that in a video next. And then monitoring and foot care. Those activities are specific to take charge of your diabetes. Next slide, please. So staff and volunteers recorded a video on Zoom so that you can see what it looks like when during a virtual workshop. We recorded 2 of the very most important activities during a Take Charge of Your Health and or diabetes workshop. Those activities are action plans and feedback. And those activities take up about 35% of each workshop session. And you'll see a little bit of problem solving in here as well. Okay, thanks, Katie.
Is anybody hearing this? Because I'm not.
Hearing.
Nobody's sending any notes in.
Okay. Can you go to the next slide, Katie? I'm not hearing you, Katie. Are you able to hear me?
Looks like it's saying she's lost her phone connection.
Are you able to hear me?
Yes.
Okay, thank you.
It says she's self-muted. Can I hear you?
She's not here.
Katie, can you hear us? Oh. It's just the other way. Peggy, are you still
I'm
doing the
still here.
presentation?
Yes, I have.
Okay, so if you can see me, let's just say to go on to the next one.
Okay, Katie, can you go on to the next slide? I'm just still seeing the scrolling on YouTube.
Same here.
Okay, thank you, Jody.
I don't know why it's self-muted, and it's not even with the microphones. It's showing the little telephone crossed out, so that's a little different.
Yeah.
Let me see, I'm trying to unmute her. There, how's that? Katie, do we have you back?
Can you hear me now?
Yes.
Yes.
Hey.
Oh, good. And so I've tried clicking in and out of the slides. Do you see them now? I show that it's showing the slide on specific improvements on my screen.
Let me see if I can find them somewhere else. Right now I'm just still seeing the video scrolling.
The circle of death, as you called it
Oh, there we
yesterday?
go.
Okay, we're back.
There we go.
All right.
Okay. Sorry for that.
That means I can go away. Okay. There we go.
Thanks,
Okay.
Jody.
You're
And
welcome.
thank you, Katie. So interesting technical difficulties, which we do experience during workshops, and we actually make it work. It all goes forward. So interestingly, I was unable to even hear the video, but I'm glad we're all back now. So those who participated in a Take Charge workshop showed significant improvements in their physical activity, their ability to socialize, as well as perform household activities. They experienced less depression, fear, and frustration, or worry about their health. They experienced a decrease in their symptoms, such as pain or fatigue, and their confidence increased in their ability to manage their conditions. And also, they have shown to lower their A1C. And A1C is a test that's conducted in a healthcare provider's office, and it shows both the healthcare provider and the patient how diabetes was managed the previous 3 months. Next slide, please. Thank you. Studies have shown improved communication with doctors, increased medication compliance, a 3% decrease in hospitalizations, and a 5% decrease in emergency department visits. So this is shown to mean a $714 savings in emergency room visits and hospital utilizations. So who is it that should participate in a Take Charge workshop? Next slide, please. Any older adult with any ongoing health condition, such as arthritis, asthma, diabetes, heart disease, COPD, and so on. Family members and caregivers, they are so welcome to participate in our Take Charge workshops. You know, often it is the family member who registers both themselves as well as the person with chronic conditions. Participation in a workshop by a family member or a caregiver not only helps the family member better understand what the person with a chronic condition deals with, but also helps them understand how a person with a chronic condition affects their lives as well. So, for instance, a family member may not be able to communicate concerns of their loved one's diet, maybe their lack of exercise or their medication compliance. Therefore, the family member could potentially become stressed, maybe irritated, or very worried. And then that can affect their own health as well. And next slide, please. Take Charge workshops. We meet once a week for 6 weeks. The sessions are 2.5 hours long. Sounds like a long time, but there is a built-in break. And when we do have the opportunity to meet in person, the ideal workshop size is 10 to 15 participants. Currently, we are only meeting virtually. Therefore, the workshop size is anywhere between 8 to 12 participants. Age Options staff provides technical assistance for all of our evidence-based programs, and that is to ensure that the participants are going to be comfortable utilizing whatever platform it may be. Age Options utilizes Zoom, and we ensure that the participants can log on to the meeting as well as utilize the functions. Workshop materials are all mailed to participants, and we do understand, we realize that a workshop is a huge commitment. People may push back. They might think, oh my goodness, there is absolutely no way that I can sit in front of my computer for 2.5 hours. And for 6 weeks? Heck no. But truly, at the conclusion of every workshop, the participants, they just think, oh my gosh, what am I going to do next week? Now what? What do you have? Is there anything else? But not to worry, because, next slide, please. They can always sign up for one of our fall prevention programs. Before talking to you about our fall prevention programs, I first want to show you some statistics related to older adults and falls. Next slide, please. This information is from the National Council on Aging, and as you can see, 1 in 4 adults 65 and older each year falls. Every 11 seconds, an older adult is treated in the emergency room, and that's because of a fall. And then this next statistic, oh my gosh, it took my breath away. Every 19 minutes, an older adult dies due to complications of a fall. Falls are also costly. The total cost of all fall injuries was $34 billion, and that was in 2013, 78% of that paid by Medicare. And while the data is not available yet, it was predicted that by the end of 2020, that amount would have reached around $67.7 billion. Excuse me. Falls are preventable. You know what? They do not have to be a normal part of aging. And that is where evidence-based programs and education can help. Next slide, please. A sip of water. Excuse me. So these are the evidence-based falls prevention programs that Age Options facilitates. They are known as A Matter of Balance, Tai Chi for Arthritis, and Bingo Size. Next slide, please. A Matter of Balance uses a variety of activities to address the fear of falling. It teaches fall prevention strategies also to reduce the fear of falling, as well as increase activity levels in older adults. The curriculum includes group discussions, problem-solving role-playing activities, exercise training, assertiveness training, and we do give them a few homework assignments. Next slide, please. Early sessions focus on changing attitudes before attempting changes in actual behavior. The exercise component of A Matter of Balance does not begin until the 3rd session, and it takes up about 30 minutes of the session, of each session, to complete the exercise portion. Participants do receive a workbook to use during the sessions, and then this is also for them to keep as a reference after the workshop has concluded. And as you can see from this slide, that after attending a workshop, participants learn to view falls and the fear of falling as controllable, set realistic goals to increase their activity level, make changes to reduce fall risks at home, as well as exercise to increase their strength and balance. Next slide, please. Now, this information is from Maine Health, the developer of the program, and it shows how successful participation in a workshop is. 97% of participants are more comfortable talking about fear of falling. 97% feel comfortable increasing their activity level. 99% plan to continue exercising, and 98% would recommend a matter of balance. I think those are pretty awesome stats. So who is it that should attend a matter of balance workshop? Next slide, please. Any adults 60 and over who either have a fear of falling or maybe they have fallen in the past. Those who are interested in improving their strength, balance, as well as their flexibility. Those who have restricted their activities because of concerns about falling. For instance, maybe a person may not visit their children, maybe not their daughter, their son, because they're afraid to fall over their grandchildren's toys. Maybe they're not going to go visit a friend because they fear that they're going to trip over the dog's toys, or the dog may jump up on them and they're afraid that it'll knock them over. Or maybe a person restricts their activities. They won't go to backyard barbecues or picnics. Not that we've had that much of an opportunity over the past year to really gather, but they may not be able to. They're concerned because the surface, it could potentially be uneven, and if they're out in the grass, they can't necessarily see if there are holes in the ground. Next slide, please. So Matter of Balance meets either once or twice a week for a total of 9 sessions, and that's right now while we are meeting virtually. When we have the opportunity to meet in person again, then they will meet, the sessions will be, they will meet either once or twice a week for just a total of 8 sessions. Sessions are 2 hours long, also with a built-in break, and the recommended class size is 8 to 12 participants. And that is our A Matter of Balance program. Next, I'm going to talk about bingo size. Next slide, please. So we just recently added bingo size to our fall prevention programs, and it is so much fun. Who doesn't love the game of bingo? Bingo size is a program that combines exercise and health information with that familiar game of bingo. It not only gets people to move and be active, but it's fun, and it's really a nice way for people to socialize. Now, participants, bingo size was developed to be in person. Obviously, we're not in person right now. So they developed a bingo size app. So virtually, the participants can either use the bingo size app, meaning that they have to use 2 different devices, a computer to log onto a Zoom meeting, as well as another device, whether it's a phone, a tablet, or another computer, to play the game of bingo. Participants who are not comfortable using 2 devices, or if they do not have 2 devices, Age Options then will mail paper copies of the bingo size cards. And in the next slide, let's hope, fingers crossed, we have a video to show you. Our instructor recorded a workshop session so that you can see what it is like to be in a virtual bingo size workshop. Okay. All right. Thank you, Katie. So we love bingo size. People who participate in bingo size, they have improved their lower and upper body strength, balance, and range of motion. They have improved aspects of cognition, improved knowledge of fall risk reduction, as well as nutrition. And at the end of the day, bingo size is social. This provides an opportunity for participants to meet and engage with others. And everybody loves bingo size, right? Who are those people who should attend bingo size? Next slide, please. Any adult at all ability levels. And with the virtual workshops, we do recommend that the participants do their exercises seated. However, there are several of the participants who decide, they may be at a different level and they would prefer to do a standing exercise. For instance, the exercise you just saw Jaime doing, that walking in place, he did it seated, but a lot of people will stand up to do that. Who else should attend bingo size? Adults who like to play bingo, and that's just about everybody, right? Love the game. And then people who also want to socialize, even if it's virtually, and especially during this time over the past year where people, they haven't been able to gather. And even though some things may be opening up a little bit, they may not be comfortable gathering, or else it's just not permitted. We do have two people in our current workshop. They live across the hall from each other, and they get together in one of the apartments. They use one computer to attend the meeting, and they each then play the game on their cell phones. So lots of fun. Next slide, please. Bingo size meets just for 1 hour, twice a week for a total of 10 weeks. The recommended class size is anywhere between 8 and 20 participants. Of course, technical assistance is provided by Age Options staff. All of the necessary workshop materials are mailed to participants if they're not comfortable utilizing 2 different devices. And that is bingo size. With that, I'm now going to talk to you about our last fall prevention program that Age Options facilitates. Next slide, please. And that is Tai Chi for arthritis and fall prevention. And this is an evidence-based program. It's designed to reduce the fear of falling, as well as improve relaxation and balance in older adults who have concerns about falls. Tai Chi encompasses a series of exercises that flow from one movement to another, and there is an emphasis on proper posture. The movements are so graceful. They almost look like slow motion dance. And then the movements are learned in following one after another. Next slide, please. Our staff member, Danielle Riley, she was recently trained as a Tai Chi instructor, and this video will show you a Thank you, Katie. Okay, thank you. So the largest study of Tai Chi for arthritis, which was conducted by Professor Lee Callahan of the University of North Carolina, found that there was significant pain relief, less stiffness, better ability to manage daily living, such as climbing stairs. Participants felt better about their overall wellness. They experienced improved balance. And who are those people who should be attending Tai Chi for arthritis? Next slide, please. Any adult 60 and over, whether or not they have arthritis. Participants may have mild, moderate, and severe joint and back pain, and people who are at risk of falling. And next slide, please. Tai Chi meets either once or twice a week for 16 sessions. The sessions are about 1 hour. The recommended class size in person would be 12 to 15. Meeting virtually, we would like to cap it at 12. And again, Age Options staff provides any technical assistance for anybody who needs it. And Tai Chi, I was so happy that I got to be a technical assistant for Danielle during her first few workshops that she facilitated. And it's just so peaceful during a crazy busy day. So it's really a nice way to exercise, and just felt good. I enjoyed it. So with that, you've learned about our evidence-based programs. Katie is next going to talk to you about how you can refer your clients to our workshops. Thank you, Katie.
Great. Thank you, Peggy. Are you still seeing my screen okay? Great. Thanks, Peg, so much for going over the various programs that we offer through the Illinois Pathways to Health. Now that we have everyone on this call hyped and ready to sign up your clients, I'm going to tell you the steps to make that referral. I'm going to go over how to use the Illinois Pathways to Health website, learn about upcoming workshops, how to make an electronic referral, and how to get information about different curricula to your clients. So I put a couple of quick screenshots in this presentation so you could reference it in the future, but we're also going to do a short demo of the website so you can see everything in real time. You'll see here that this is our landing page, and one of the first things that you see is a Find a Class button. When you click this, you'll get a drop down of all the programs offered, which I'll show you on the next slide. And you can also narrow down the classes offered based on zip code or location.
Hey, Katie.
So, yeah.
Oh, sorry, we got that real fuzziness back, and it's not you speaking, it's more of the line.
Is that better?
I won't know till you get talking, actually.
Okay, here, I can also just try. Is this better?
I think so, yeah. Try that for a little bit and see how that comes.
Okay, good. There we go.
Okay.
So these are the programs for which you can filter. You can click and find a workshop and see all the workshops scheduled at the time that you're viewing the page as well. When you select a program and you put in the zip code, this is the output that you're going to get. It's going to look like this. It's going to give you a longer list, but I couldn't get a screenshot that would fit on the slide of all of the programs listed here. And we're going to zoom in here on that Find a Class section. This gives you an opportunity to refine based on your zip code online within a certain number of miles. You can sort by distance. So sort and filter options, or you can just redo your search if you're not seeing a program that works for you. Please note that right now, all of our classes are online, but this will be an important feature someday when we're back in person. If you do not see an upcoming workshop that works for your client, you can also make a direct referral to us. This is also a screenshot from our homepage. You can enter in your client's information, and a member of the health promotion team will follow up with them and get them signed up for a workshop that we have already scheduled, or we'll put them on a wait list and make sure we give them a call as soon as we have a workshop in the curriculum that they'd like to participate in. To help support you all in talking with your clients about our programs, we have PDF handouts that you can download and print out, and you can give them to your clients at a face-to-face visit, or you can email them as a follow-up to a visit if you work with them electronically. We also have handouts that have talking points for how to present the workshop to, it's on a healthcare page, so it's how to present it to a patient. But these talking points are also really beneficial for clinicians, and can be used in non-medical settings. Now we're just going to do a quick demo of the site. There we go. And so you'll see right here is the find a class. Of course, well, there we go. Let's see. Let's say we want to see a Tai Chi class because that's what we just saw. And let's say we want to see one online. We'll do search. And here we go. We have one Tai Chi for arthritis class coming up, and that's going to start here on June 1st. Now let's try to make a referral page so you can kind of see all the information that we're looking for. Most of this information you should already have in your client file, but we really don't need everything. This just kind of helps us out. So we don't need to ask that information of the client when they sign up for a workshop. But the big thing to make sure that we know is we do need that first and last name, and we do need that phone number or email address so we can get in contact with them. If you click up here on our programs page, this is where you can get quick snippets of information about the program, or you can click right here and you can get a downloadable PDF that you can print and share with your client when you're talking to them about the program. If you click over on the For Healthcare Providers page, you can also click on these handouts, which are framed a little bit differently. And some information that you might want here is how to discuss this with your patient. And again, this is also valuable information in non-clinical settings. And so we just have one more quick video for you all. There we go. And so that was just one of our participants for one of our diabetes workshops that Peggy and I are lucky enough to get emails and letters and phone calls for participants from all of our workshop series that are also telling us about the great benefits that they have from participating in this workshop. So to kind of wrap us all up, I used to watch a lot of David Letterman when I grew up, so he always had a great top 10 list. I just have a top 5 list, and it's not going to be quite as funny, but hopefully we'll still get you really excited about sending some of your clients our way and making some referrals for health promotion workshops. So number 1, we have better management of conditions and fall risk reduction means fewer days in the hospital or doctor's offices and more days at home. And that's really why our clients are in the community care program, because their goal is to stay at home for as long as possible. Number 2, they get opportunities to socialize and connect with other people through our workshops, so it also helps with feelings of depression and isolation. Number 3, you want to empower your clients to take charge of their health, and we have the tools to help you do that. Number 4, you sleep better when your clients sleep better. I know that I feel better when I know that our participants are doing well. And finally, complications for your clients likely means paperwork, and nobody likes paperwork. So let's keep people happy, healthy, and independent to the best of our abilities. Does anybody have questions? Peggy and I gave you a lot of information.
Okay, we did have a question come in. Are these programs for people who live in Illinois only?
So the Illinois Pathways to Health is for folks that only live in Illinois. Other states have other programs. So many states do offer the chronic disease self-management program or take charge of your health, and they have different setups. But our licensing is for Illinois residents.
And the age 60, is that a hard line also?
No, not at all. So earlier in the presentation, I said, like, theoretically, our programs are to support older adults, age 60 and older, but really anybody who has a risk of falling, has a fear of falling, has concerns about their chronic conditions, send them our way. We want to help everyone, no matter their age, to be able to better manage their conditions.
Great, okay. Let's see, any other questions?
Well, while you guys type your questions here, I'm going to show this next slide that will come into the come in the presentation that you'll get emailed to you. For those 2 websites that I show you, or those 2 pages on the website that I showed you, this is where you can get those 2 sets of handouts. You can find the videos if you had a hard time hearing, or if you want to watch the entire video, that's our YouTube page. You can also check out Age Options Facebook page, and we also update information there about upcoming workshops. And I guess I'll take any other questions while I leave it on this slide, so people can write down Peggy and my email if they have any other questions.
The other question I do see is there a fee?
There's not a fee for any of our programs at this time. Right now, we are able to sustain all of our programs through Administration on Community Living funding, Title III-D funding, and some other funding sources as well. We are looking for long-term sustainable funding, but right now we are able to offer everything for free.
Oh, that is great. Okay, so we better get it while it's free. Hopefully you'll find that funding for a long while now. Okay, any other questions? We'll give you a minute to send those in. And ladies, I'm sorry, I don't remember, you probably said at the beginning, how long have you had these in place?
Oh, that's a great question. I think that the Illinois Pathways to Health programs generally, so before they became the full initiative, the chronic disease self-management program and diabetes education program, I think started in Illinois in 2010, but Peg might have better history than I, because she's been with the organization a little longer.
Potential. I kind of started it that year, but I don't know why 2008 maybe that's when they were starting it, getting trained in the program, but around there, a long time.
And as are these participants, are you getting more participation now that they are doing it through webinar, that they can be farther out, or are you getting a little less because it's not in person?
You're a little of both. Sometimes it's difficult to get information about the workshops to the end user. So we send out flyers and do email blasts through our network, hoping that everybody is sharing with participants. And so nationally, it's been, for Take Charge of Your Health, it's been a little bit lower. Bingo size, people were jumping on it when they learned about bingo size. So it's all a little bit different. The one thing about offering them virtually right now is that there have been a couple of workshops where participants have said, you know, if I had to go to the senior center today, I would not have gone because I'm feeling a little bit off. But they were able to attend because they didn't have to get in their car or take public transportation.
Nice.
To get to a workshop.
Okay.
Yeah.
I did have a request for you to go back to the previous slide so they can look at those web pages again.
Yes, absolutely.
Okay, then another question came up. Do senior centers offer group participation so that a group of participants can do these programs?
Historically, the programs, when we were able to offer them in person, they were offered through senior centers, senior buildings, churches, libraries, village halls, fitness centers, wherever people would gather. And
so we could potentially see right now groups from senior centers, nursing facilities, adult day centers, any place that they're kind of are already naturally gathered would be a place they could do a group session.
absolutely, if community rooms are available, a computer could be hooked up to somebody's TV and it could be a group session there. We could still do it virtually. It just depends on the local health department as well as, you know, the ability to be able to gather.
I could really see some adult day services using this. They're already smaller in number than they used to be for how many are in there at a time. So the number of those people in the sessions is going to be a little bit more equal to what you have now. So, okay. Yeah, that's one good thing that has come out of all of this is us learning how to, or more people learning how to use the internet and the systems and getting into all of this. So that is great. I just want to page down, make sure I got everybody. This thing seems to jump around all the time. Okay, ladies, I do want to ask 2 more questions. Well, one question of the 2 of you. How has introducing these programs and having people give feedback changed how you feel about them?
I'll let Peggy start because she has the opportunity to facilitate more often than I, and then I'll jump in.
These programs are in my heart and soul. I am so passionate about these programs. And I want to say that I'm always sad when a workshop ends because you get to know you get to know the participants, and it's just a sense of feeling like I'm making a difference, but more so that the participants are they're able to gather virtually, but they're able to feel more confident in their ability to manage. So I love these programs, no matter which one it is. Yeah.
And I love having the opportunity to work directly with clients. That's not something that I get to do often. And what's always really memorable or really impactful for me is those action plans. So one of the first videos that we showed you were those action plans. And that very first session, people might start off a little modest or a little unsure, and they start with something, maybe I want to walk 500 steps a day, or I want to just walk to the end of the block and back. And by session 6, they're telling you, I walked for 30 minutes straight. I didn't need to sit down. I made my way. And so we get to actually watch that improvement happen over the time that we're spending with them. So I think that is such a meaningful and exciting opportunity to be able to have this type of programming.
Wow. Okay, great. Okay, ladies, I want to thank you for a wonderful presentation. I want to remind everybody out there that yes, the recording will be coming out as soon as it all goes through. So probably Friday or Monday, Tuesday, so it'll be very soon. A copy of the presentation and a PDF will go along with that. Any handouts that we have will be in there. And another reminder, if you're getting CEs, that entries for that will be in the survey. And please, everybody, do fill out the survey so we know what worked best. Any suggestions you have, experiences, we really want to know that back. Also, it is asking about any future presentations you would like to see. So do fill out that survey. Thank you, everybody, for participating in this today. We had a very good turnout. So we look forward to seeing all of you in the future, and that includes Katie and Peg to come back and talk to us, and we will see what happens. Okay, thank you, everybody, and I am going to, they said great job, ladies.
Oh, thank you so much, everyone. Thank you for this opportunity, and we cannot wait to get your referrals.
Thank you.
This will be great. Okay. Thank you, everybody, and I'm going to end the session now. Enjoy the weather and have a safe month. Goodbye.